Ontario's science table released new modeling today, and it finds Omicron's decline has stopped and cases will likely go up again. But even with high daily case counts, it's not all doom and gloom.
We're in a wobbly phase of the pandemic. We should not be deluded by the numbers we're seeing in the statistics. Our true numbers of infections per day are probably around 15 to 20,000.
Up to 20,000 cases a day sounds daunting, and wastewater testing signals cases are on the rise. But with the high rate of vaccination and immunity from prior infections, Dr. Yuni from the science table believes Ontario can handle it if people stay cautious.
If we take it slow, meaning we only moderately change our behavior, we basically continue to mask if in doubt, and we don't dramatically increase our contacts, especially unmasked contacts, we will probably see some uptick in hospital and ICU numbers, but not that dramatic.
Modeling from the science table shows ICU cases could rise to 300 by May. They are currently below 200. A spokesperson for the Minister of Health released this statement saying, in part, our hospitals can manage any range in these latest projections. Restaurants and other businesses are already open at full capacity. On Monday, masks will no longer be required in most settings. Dr. Yuni points to countries in Europe as examples of why Ontario still needs to exercise caution.
When we look at places like Switzerland, Iceland, Denmark a bit earlier, you find a lot of places where just, a relatively dramatic change in behavior was associated with explosive growth. In my home country, Switzerland, since they lifted nearly all the public health restrictions, including mask mandates, we see a U-turn from roughly 15,000 cases per day to now more than 25,000 cases per day, which translates into roughly for us 100,000 infections here in Ontario per day. We don't want to go back there.
The Ford government's messaging is that people need to learn to live with COVID and that masks will be a choice.
If someone wants to keep them on, God bless him.
The Premier says he will wear a mask when he visits his mother-in-law in long-term care and in the legislature when it resumes next week. Yuni says he too will continue to mask.
So is it the right time to lift masking in schools?
I personally would have preferred to wait another 2 to 3 weeks.
Yuni, though, says he is currently cautiously optimistic about the days and weeks ahead. The NDP responded to today's modeling by calling on the Ford government to protect workers by giving them 10 paid sick days.